Welcome to a brief overview of the IHI TripleAim. My name is Carol Beasley, and I'm an Executive Director here at the Institute. For the next few minutes, I'll provide an overview of the design concepts that go along with the TripleAim. When we speak of the TripleAim, we're speaking of system designs that serve populations and require integration or an integrator function to achieve them. This means that we're working on simultaneously improving the health of whole populations, improving the patient experience, including the quality of care and their satisfaction with that experience, and reducing the per capita cost of health care. Here's a conceptual representation of what an enterprise designed to achieve the TripleAim would look like. We start with a focus on quality as defined by the individual. Getting acquainted with the point of view of individuals is a source of insight for populations. We speak of acting with the individual and learning for the population. All of the action and learning that we're doing is filtered through the TripleAim. We keep all three aspects of the TripleAim in mind at all times. We're focusing on systems here, and the system that we're focusing on is actually bigger than healthcare. We know that there are many contributors to health, of which healthcare is only one. So when we think about the focus of the system, it includes healthcare, it could include social services, public health, community organizations, even workplaces and schools. As improvers, we're always focused on the metrics that will tell us if we're on the track to improvement. Fortunately, in the TripleAim, we do have measures. Measures exist now that address all three dimensions of the TripleAim. It's still a challenge because, for the most part, there isn't a single or solitary organization with the experience and the access to all of these measures at the same time. But the good news is that they do exist and we can start to use them. Going back to our model, we're going to focus on the right-hand side. These are the areas of change and improvement and learning that are taking us down the road on our TripleAim journey. We'll start with the first two boxes, individuals and families, and the definition of primary care. Individuals and families are key contributors to attaining the TripleAim because each of us manages our health and our health care most of the time, even those of us who may be fairly ill. Each person knows more about their needs and their situation than professionals can know, and this knowledge is extremely valuable and helpful in redesigning systems of care. One of the strategies we've used a lot is to go deeply into the experiences of a small number of individuals, and this reveals opportunities and ideas that would not have been visible otherwise. The second area is to focus on primary care, remembering that we'll use a somewhat expanded definition of this. Here's an example from one of our participating sites, Genesis Health in Michigan. When they developed a care navigation role in their primary care practices, they really stretched to include many aspects of the community around them. In this example, the navigator is offering real-time nutrition coaching while someone is shopping in the grocery store. These care navigators have learned to connect their primary care patients to many kinds of community services, including housing, food assistance, addiction counseling, job training, domestic violence, and other issues that affect the health of their population. We'll go back to our model and start working up from the bottom and talk about prevention and health promotion, per capita cost reduction, and integration. Here's a great example of prevention and health promotion that comes from the Bolton Primary Care Trust in the northwest of England. They undertook a community-wide initiative to reduce the risk of cardiovascular disease called the Big Bolton Health Check. They screened every person in the region over the age of 45 and got them into medical treatment for undiagnosed cardiac risk and helped them with lifestyle management. You can see what has happened over time. Actual heart attack rates are falling, and they're falling faster than they are in the country as a whole. This is translating into better health and actual reductions in mortality, again, at the level of an entire region of several 100,000 and faster than the country as a whole. Cost is a major area of opportunity and redesign in the TripleAim. Our work has shown that there needs to be an intention and focused work to reduce costs. It's not simply a byproduct of better quality. One of our models in this has been QuadMed, a printing company that created its own healthcare system for its employees, which has been pursuing TripleAim results for a couple of decades. By emphasizing excellent and accessible primary care and helping employees to adopt healthier habits, they've opened a big gap between their per capita cost for health care and that of the other employees in their region. You can see how large that advantage is for each employee in their organization. Here's an example from another TripleAim participant, Bellin Health in Wisconsin. Bellin has a strategic focus on serving the employers in their region, and they started to build their system by focusing on their own self-insured population of employees. By making it easy to connect to the right level of care any day at any time, making that care reliable and efficient, and helping employees reduce their health risks, they too have opened a gap between per capita cost in their organization for their employees' health care and the average for their region. We are optimistic that TripleAim teams will succeed in actually reducing the per capita cost of care, not just in slowing the growth of cost. Finally, system integration. This work requires alignment among organizations and functions that are usually not within a single organizational system. This means new ways of leading, governing, and collaborating. Key enablers of system integration are shared purpose, a common set of aims and measures, a portfolio of projects that works together towards TripleAim results, and a system of governance that keeps the work moving forward. Governance models can range from the informal, such as committees or alliances, to more independent and formally constituted organizations. This concludes our introductory overview of the IHI TripleAim and what we believe it will take to build a successful TripleAim enterprise. We invite you to learn more, to explore how this framework might bring value to your organization, coalition, or community. Please visit our website, try out our self-assessment tool, or email us at tripleaim@ihi.org. Thank you for listening.